Hello there. So today I'm going to be talking to you about treatment options for canine parvovirus. Up until recently, we would typically tell people that treating parvo, we're not actually treating the disease itself, we're treating the underlying conditions, the vomiting, the diarrhea, the dehydration associated with it. But in the past year or so, there actually is a treatment that has come out for parvo. It is called the parvo monoclonal antibody. It's an injectable medication that can be given at your veterinarian. Not every vet clinic is going to carry it because it is a little bit expensive and it's not 100%, but it is giving us much better results than really any previous parvo treatment. But parvo treatment can also include kind of controlling all the things I talked about in my last video, controlling dehydration, controlling infection, giving them the ability to take in calories, those kinds of things. Now, your best option for treating parvo is going to be treatment at a 24-hour hospital, so they can be getting IV medications and IV fluids. Typically, you want to treat them until the vomiting stops so that they can take oral medications so that you don't need the IV stuff anymore. So I've got kind of our typical treatments that we have written down. Don't have the dry erase board today. So the one that gives you the best potential is going to be hospitalization at a 24-hour hospital with that parvo monoclonal antibody. The combination of those two together give you actually a really good percentage chance of a puppy recovering from parvo. Second would be hospitalization without the parvo monoclonal antibody. Since the medication itself is so expensive, taking it out of the equation still gives them a decent chance, just not quite as good. 3 would be hospitalization at a general practice, so the kind of place that won't be able to do fluids overnight with that monoclonal. 4 would be hospitalization at that type of practice, so no IV overnight without the monoclonal. And last but not least would be what we call the outpatient procedure or the outpatient protocol. That's typically where we give them an injection of anti-nausea, antibiotic, and fluids into the skin and send them home with some medications. In a lot of instances, we can get decent response with the outpatient protocol, but it is not nearly as effective as that 24-hour hospital with the parvo monoclonal. Now, unfortunately, it does typically come down to price. Even though one has the best typical outcome for dogs and another has an okay outcome, really it is price that dictates things. I've seen some 24-hour visits with that parvo monoclonal where people are spending 10 grand on parvo and they don't recover. And I've seen on the flip side where people spend 200 or 300 on the outpatient and they do just fine. It's a very touchy disease, but realistically it all comes down to if we can control, like I said, vomiting, dehydration, all of that.